My name's Adam Burnett. I'm the executive director of Champ Homes, and we provide transitional housing to folks that are experiencing homelessness here on the Cape. At Champ Homes, one of the differentiators that we try to instill is a sense of community and a sense of family. So oftentimes folks are coming to us and they haven't had a loving family-like experience. And so something that makes us unique is that we really, again, try to foster that. And we foster it in a number of different ways. It's the groups that we offer, it's the meal times that we provide dinner Monday through Friday. And everybody traditionally comes down, they grab food from a buffet line, they go to our cafe and they break bread together. They get to know each other, they support each other. And with COVID in early March, we had to fundamentally change a number of things, but probably the most impactful was the way that we prepare and disseminate food to our 40 to 50 champs at any given time. So at that time, we felt as though the responsible thing to do was to purchase takeout food from local area restaurants. We saw the need for restaurants to survive those early stages of COVID as well, and decided that we were going to do an impromptu fundraiser where we were able to raise $15,000, and then for the next 40 days we purchased takeout food, again from local area restaurants, individually wrapped, and each evening we were hand delivering the food to people that were here and asked to quarantine because unfortunately we did have a number of cases of COVID positive here. It flies in the face of the way that we traditionally try to foster that family-like environment. And to this day, we still feel as though, well, while we are preparing food here now, we continue to individually wrap it, and we now ask people to come down to the kitchen, grab a portion, and then disseminate. They can go to their rooms, they can go to our living rooms, and while the weather's nice, we're trying to encourage people to eat outside as well. In late March, we had the first person who was showing a symptom go for a test, and we had developed a containment policy where we have 4 houses here, and if somebody went for a test, then we were going to tell that person to quarantine to their bedroom and everybody to quarantine to the house to ensure that it wasn't going to spread across our campus. It's very difficult to manage that here because it's communal living, and they all share living rooms and they share bathrooms and they share kitchens, and how do you quarantine somebody to a bedroom that doesn't have a bathroom? So we had to designate certain bathrooms for COVID positive or COVID waiting results, and those that had tested negative. Additionally, because we had first confirmed positive and then a week later second confirmed positive, we fought tooth and nail to get cluster testing here. And once we did, we realized that we had a number of cases, most of which were asymptomatic. But that created a situation where we actually, in our main building where we had 23 people living at the time, we had all 23 people quarantined to their bedrooms for a total of 24 days. And that presented a number of challenges, including traditionally we're not staffed nights and weekends. Our staff worked 7 days a week to hand deliver food, drinks, personal need items to the folks that were quarantined to their bedrooms. And here at Champ Homes, we have single, double, and triple occupancy. And you might not necessarily know or care for the person that you're living with. And so with a number of folks having some mental health issues as well, it was very, very difficult to manage their mental health and all of the other moving parts during what ended up being pretty much the entire month of April. So in the early stages, I would say the first and second week of April, we again had a number of cases that were coming up positive at that time. And that was really when everybody started talking about masks as a prevention tool. And it wasn't quite known yet whether it was prevention or it would keep you from catching it. There was some counter information surrounding that. However, we didn't have the ability to just go onto Amazon and order a bunch of masks. They were all sold out, and the PPE that was designated for nurses and doctors, the N95 masks. Those were few and far between, and probably not the best utilization of those limited resources here. Hyannis Fire Department gave our staff N95 masks so we could go in and out of the building and theoretically not catch it ourselves. However, we needed to think of ways that we could best protect our champs here. And so I put out a call on Facebook asking if anybody could help with masks. And you would not believe the response that we got. Within a couple days, I had at least 10 people volunteer their time, their services, and one person would produce 10 of them, and the next person would produce 15, and the next person would produce 20. And before I knew it, I had well over 200 masks for our 400 people, for our 40 people. And so we had an abundance, and I knew that other organizations didn't necessarily have that good fortune. And so we shared them with the local shelter, St. Joseph's, and with a number of other organizations that were having a more difficult time. But the outpouring of support from our community, from people I know very, very well, and people who I still haven't even met. I just met them in a parking lot, and they handed me masks sometime in April. It was absolutely tremendous and really heartwarming, and it reminded you about what makes the Cape so special, so unique, is the fabric of the community and how we all tend to look out for one another. So any organization that is in the throes of this and dealing with an unprecedented, unique situation, if you're dealing with humans, I encourage you to be human. If you have employees, I encourage you to think from their perspective. If you work with individuals, try to be mindful of their needs during this time. Try to understand that everybody comes at this from a completely unique perspective that is their own. Some people have never met somebody that has contracted COVID. Other people have their loved ones that have battled with it. In some cases, they've lost loved ones. And so everybody has a unique perspective on what COVID means to them, to their families, and to their community. And I think that we should all just be mindful and compassionate of everybody's perspective at this time. Here at Champ Homes, we have to raise 50% of our budget. And this year, we had slated $75,000 that we were going to raise through events that we can no longer host. And that, coupled with people feeling different economic challenges associated with being out of work or having increased costs here, there, and everywhere, has made 2020 incredibly difficult to fundraise for local nonprofits. Some of us have been fortunate enough to have incredible backing from local businesses, from sponsors, from individual donors. Champ Homes has been fortunate enough to be able to sustain this year and not be too terribly far off of what our original goals were. But we're all feeling it in different ways, and it's definitely an obstacle that we did not see coming, and we just are going to be forced to work through.